My name is Dr. Peter DeWitt. I am an integrative medicine specialist, family physician by training, but having specialized in integrative medicine over the last 22 years. I've been in private practice and owner and director of the Quantum Healing Institute in Tyler, Texas. And one of the modalities that I use in my practice a whole lot is called recall healing. And recall healing is probably the modality that I'm the most excited about of any of the modalities that I've got to use. Over the years, I really had a feeling that there was something that was going to help us to understand the root of disease, and that's exactly what recall healing has done. Recall healing basically is based on the premise that behind every disease there is an unresolved conflict that programs for the disease. So what happens is when you are threatened in some way, when you're or severely traumatized either physically or emotionally in your life, in order for the brain to be able to survive, and in order for the circuitry in the brain not to be destroyed as a result, the brain then downloads this conflict to a smaller part of itself, and at the same time it also launches it into the body itself. But what is so fascinating is always conflict specific. So I'm going to give you an example of a case that I had more recently. And this is a patient of mine that is 67 years old. And pretty much, she's got some health challenges, but the one thing that she never has really had a problem with is bladder infections. She's had a pretty good bladder. So she goes to visit her daughter in California. And her daughter is a physician in California. And both mom and daughter are a little bit controlling, extrovert controlling types. So she's in the home with her daughter and, basically relegated to sitting on a butt, out of the way, because the daughter doesn't want her to interfere in the house duties and, in cleaning or cooking or anything, because, she wants control of her household. So mom is, kind of, almost beside herself with frustration by the time she gets to the second week of visiting with her daughter. She has a lovely time with her grandkids, but frankly can't wait to get home back to Texas. So lo and behold, as soon as she gets back to Tyler, within hours she starts noticing that her urine is burning, and she's developing frequency, and eventually she's got a little bit of blood in the urine, and within 24 hours she's got a full-blown bladder infection. She knew enough about it to know that that's what she had. So in discussing this with her, she came in to see me, and immediately my first question, because I do this with every patient, I always want to know, what is the program? What is the conflict that has led to this? So I asked her what happened just before this started. She said, oh, well, nothing stressful. I was in California visiting my children, my daughter and, my son-in-law and kids, grandkids. And I asked her about the trip, and, she said it was fine, And then I started to kind of digging a little bit, and it turns out that, yep, she did have this frustration, and, yep, she could not talk about it. And this is always the case with these conflicts when they download. It's not the stuff that we can talk about and clear. If you tell somebody, hey, don't be a so-and-so, just calm down, that's better. But when you have to sit on it and push it down, that becomes the conflict that programs for the disease. And that's exactly what happened to her. So lo and behold, within 12 hours after discovering this conflict, having a good laugh at herself, being able to tell me how her daughter just really pissed her off, her bladder was much better. We gave her a couple of herbs to speed up the healing process, but all symptoms disappeared. She didn't have to go on antibiotics. That would have destroyed the good bacteria in her gut. She didn't have to do all that kind of stuff, and she's back to full health, and she hasn't had another bladder infection. So, interesting example of recall healing in action.